Welcome to the sixth presentation in our series on family involvement in dementia care. This program builds on earlier content about having conversations with providers to find mutually satisfying approaches to care. Today, we'll build on our last program about understanding behaviors, and we will discuss responses to challenging behaviors that are commonly seen in dementia care. To quickly review what we discussed in our last program, we know that there are a wide range of behaviors that occur in dementia care. These behaviors often accompany changes and losses in the person's abilities related to dementia. We also know that challenging behaviors often cause tension between family and providers about the care of the person with dementia. With that in mind, understanding behaviors is the first step. The next step is learning how to appropriately respond to those challenging behaviors. When responding to behaviors, think carefully about unmet needs. Is there a physical cause, such as pain or hunger? Is the cause psychological, like a lack of meaningful activities or loneliness? Are there too few or too many social interactions? Looking at the physical environment, is there too much or too little going on? Or could there be an overlapping illness that is contributing to the behaviors? Thinking about the possible unmet needs can help to guide care and our response to avoid contributing negatively to the situation. Managing difficult behaviors can be one of the most challenging aspects of being a family caregiver to a person with dementia. Here are a few tips from family caregivers. Meet with care staff routinely for updates and feedback about what is or is not working regarding behavior interventions. Brainstorm on ideas together. Encourage your loved one to do as much for themselves as possible. Include your loved one in the conversation with care staff. Do not talk around them. Today, we will go over 4 keys to responding to behaviors. The first is the importance of staying person-centered. The term person-centered refers to thinking about the individual and asking yourself, who is this person? What are the long-standing habits, values, and beliefs of this person? It is incorporating those factors into the care routine, along with supporting the person's current abilities. Do only what the person cannot do for themselves, and try not to take over the task for the person. Encourage them, cue verbally, simplify the task as much as possible, and help them to get started, and then step back. When staying person-centered, also ask yourself, what can we reasonably expect the person to do given their abilities and the situation? Keep in mind the stage of impairment, other health-related or physical challenges in function, the individual's long-standing personality, preferred routine, habits, and schedule, and also the available resources. Staying person-centered during tasks may take a little more time, but it is time well spent to promote the person's independence and abilities and to reduce challenging behaviors. Now, let's look at some approaches you can try when dealing with challenging behaviors. Adjust your care approaches to the needs and abilities of the individual. You may find it useful to use elements of cueing, prompting, reminders, encouragement, and praise when assisting a person with a task, such as brushing their teeth. Another helpful approach is to use touch, such as a hand-over-hand technique, or tapping the person's arm or shoulder for the direction you are turning when walking. Avoid trying to reason with the person or to try to teach them new skills or routines. They may not be able to retain new information, and using these techniques or asking them to try harder will only frustrate the person. Always work at the person's pace. Do not rush or hurry them. Follow their lead. If they are resistive, take a break and try again later, or have another person approach. Get to know and follow the person's preferred routine. And never argue logically. It is not effective and will only contribute negatively to the situation. Another key is to keep it simple. Break the task into smaller, more manageable steps. Redirect or distract negative responses with a positive approach, such as talking about a topic of the person's interest or singing a favorite song. Encourage a sense of control, choice, and involvement of the person in their care. This can be supported by offering simple choices rather than asking open-ended questions, explaining and involving the person in their personal care, helping them to get started on the task, and cueing as needed. Always avoid doing a task to or for the person without explaining what you are doing, and do not assume that they cannot understand, no matter how far progressed in the disease they are. Adjusting your communication can be very helpful when engaging the person in their care. Use short phrases, simple words, and avoid using jargon. Be specific and use terms the person understands. Also, be aware of your nonverbal language and gestures. Monitor your tone of voice and facial expressions, and use nonverbals to help convey your message by pointing or illustrating a task or to help the person get started. When providing care to your loved one with dementia, it is important to not confront or correct them. They simply may not be able to remember, and arguing does not help. Also, avoid statements that they are wrong. For example, if the person with dementia is looking for their father who passed away years prior, rather than telling them that their father is dead, you can use a conversational orientation such as, "Tell me about your father." Using this approach may act to distract the person from their worry or stress, and instead bring about positive reminiscence and conversation. Family caregivers sometimes mention a feeling of discomfort with responding to a loved one's questions, such as looking for a parent who you know passed away many years ago. Therapeutic approaches can help. Let's take a look at a case study and discuss how you may respond in this situation. Jim's wife, Beth, lives in a memory care community. When Jim visits, he often finds Beth pacing, upset, and stating that she wants to go home. He knows that she will not be able to return home, but does not know what to say or how to respond. How should Jim respond? The approaches to care that we take as family caregivers and providers greatly impact the response and the behavior of the person with dementia. Sometimes we also need to respond to behaviors by adjusting environmental factors. Let's talk about that a little more. Reduce misleading stimuli that may cause confusion or anxiety, and, ultimately, behavioral responses. Reduce clutter. Monitor noise levels or confusion, such as television programs or overhead speakers. Use personal or familiar objects as much as possible. Be aware of lighting to avoid shadows or glare. Also, remove or disguise objects that may be misinterpreted. For example, a mirror may upset a person with dementia as they may not recognize their own reflection. By simply covering up the mirror, you can reduce the negative emotional response and, in turn, the challenging behavior. Adjusting stimulation to the individual's needs can also help to reduce challenging behaviors. Watch the person's cues and adjust the activity and stimulation based on their level of engagement and comfort. Use their long-standing habits to guide routines, as well as consider the timing of challenging behaviors. It may be the time of day, such as the late afternoon. And then think about what that may mean. Is the person bored and they need a meaningful activity to engage in? Or perhaps they are tired and need a low-stimulus activity or rest to recharge. When we are talking about adjusting stimulation and engaging the person in meaningful activities, There are a variety of supportive interventions that can be used and personalized. Let's take a closer look. Supportive interventions that may lower levels of agitation include aromatherapy, interactions with pets, the use of music, exercise, reminiscence, and socialization. The key is to tailor the activity to the preferences of the individual. The information you collect about the person and his or her abilities, daily patterns, and unmet needs will help you tailor activities to that person. Instead of offering one-size-fits-all programs, you'll be thinking about this unique individual and what fits best. We also need to ask the person and his or her family about personal preferences for activities. Instead of assuming the person is unable to express their wishes and desires, try asking the person. Also, take into account the characteristics of the person. Are they quiet and need prompting or encouragement to attend a social event? Or are they outgoing and need direction and access to events? As always, consider the person's abilities to be sure that the activity is adapted to their specific needs. Keeping the person at the center of all care interactions is essential in responding to behaviors. By knowing the person, we are better able to identify unmet needs and take proactive steps to reduce challenging behaviors before they present. Let's take a minute for a breakout discussion. Responding to behaviors can be challenging, frustrating, and emotional for the caregiver. What are some coping strategies that you use for yourself when responding to your loved one's challenging behaviors? Please pause the presentation now to allow time for self-reflection or group discussion. Press play to continue when you are ready. When responding to behaviors, use ideas that we have learned in our earlier programs. Gather the needed information on the person. Set a time to discuss and problem solve as partners. Use a give and take approach. And always focus on a win-win solution to the issue. Keep in mind that the goals of care will likely change as the dementia progresses, so be prepared for the future. As we have reviewed, challenging behaviors are a common source of tension between families and providers. Behaviors can raise many questions that lead to differing opinions to the cause of the behavior or the care approach to be used, but it is important for family caregivers and providers to work together to discuss, share information, and aim for a win-win solution. In our next presentation, we will discuss tips for talking with providers about medications and treatment use, adverse side effects, and other options to make better informed decisions.